The Kenya Medical Supplies Agency, Kemsa, is in financial crisis.
Well, a rush to pay off COVID-19 suppliers during the electioneering period last year, coupled with a huge debt to supplies, has brought operations at the country's main medical stores to a near halt, leading to a stockout of crucial medicine and medical supplies. Brenda Wanga reports on the unfolding situation at the troubled Kemsa.
For that question.
The Council of Governors was the first to raise the red flag over the imploding Kemsa medicine and supplies shortages at the counties that have left the devolved units at the mercy of private suppliers charging exorbitantly for medical commodities that should have been supplied by Kemsa.
They are suffering because they refilled it for Kemsa. The turnaround time for even delivery are wanting. We are talking about 2 to 3 weeks delivery. We are talking about refill rate of about between 55 and 70%.
It is now emerging that the problem runs deeper. Documents in our possession show that the Kemsa stores are facing a stockout of 390 out of a possible 462 medical commodities, which include, amongst others, painkillers, antibiotics, and other commodities including gloves, syringes, cotton wool, bandage plasters, pap smear kits, and yellow fever vaccines. These commodities stockout blamed on an accrued debt of close to 4 billion shillings that Kemsa owes different categories of suppliers. According to a Kemsa payables statement for the financial year 2022-2023, as at April this year, Kemsa owed a total of 3.8 billion shillings, and of that amount, 23.5 was due to operations, where the Kemsa capital took 3.49 billion shillings, that is key for the acquisition of medical commodities. 55.97 million shillings was debt accrued for supplies during the COVID-19 pandemic, while 107.5 million shillings was listed as uninvoiced COVID-19 receipts. 24.85 million shillings is owed for the distribution of Kemsa supplies, while a further 150 million is listed as debt accrued for distribution alone this year for the period of January to March. Where the bulk of the debt is owed to medical supplies, Kemsa paid over 900 million shillings to COVID-19 suppliers in just 6 months, from July to October last year, the months preceding and after the elections. Among the companies that were paid were Kemri, which was paid 7.6 million shillings for transport services. Abyssinia Group of Companies was paid 18 million shillings for the supply of KN95 masks. Medisystem Supplies and Services, which supplied theatre booths, was paid 115,000 shillings. La Miguela Holdings was paid a total of 90 million shillings for the supply of PPE kits. Shop and Buy, whose owners were at pains to explain how they got a 1 billion shillings tender to supply COVID-19 items, were paid 498,750 million shillings for the supply of PPE kits and KN95 masks. Medilife Biologicals was paid 110 million shillings for the supply of 3-ply and KN95 face masks. Salgad Investment Limited were paid 12 million shillings for the supply of paracetamol. Triple Edge was paid 12 million shillings for the supply of KN95 respiratory face masks, and Pasaiba Tourmaline Limited got 4.5 million shillings for the supply of KN95 respiratory face masks. The COVID-19 payments coming at the expense of the procurement of essential commodities, a move that now sees the country's majority healthcare seekers facing shortages of basic and critical medicine and medical commodities. Sources intimate that the COVID-19 payments ate into the bulk of Kemsa's capital that could have been invested in the organization's core mandate, that is ensuring the supply of medicine across the country. Kemsa also stands accused of prioritizing clearing the debts that do not touch on its core mandate, the reasons why debts owed for the operations are less than the ones owed for the procurement of medical supplies.
Why is Kemsa in such a situation? When we talk to them, they tell us that there's a big gap in Kemsa. Big gap because during COVID, they bought commodities that today are still lying in their stores but cannot be sold.
This is where it all
The stockout at Kemsa is just part of the troubles plaguing the organization, as it also faces a probe into the bungled procurement of treated nets by the Global Fund that sees the country stand to lose a 3.7 billion shillings tender. Brenda Wanga, Citizen TV, Nairobi.